All right, welcome to Pharmacology. Today we're going to be talking about aspirin. So a little bit of description about aspirin. As far as ACS goes, or acute coronary syndrome, there's been no other medication that's been shown to be more effective treating of an acute myocardial infarction, especially for such a little cost. So what this is doing to the body is it's inhibiting the platelet aggregation to reduce any additional blood clotting. You'll also see this written as ASA, which is acetyl salicylate acid. And the important thing I want you to remember here is the salicylates. I remember when I took registry, I saw a question that said something to the effect of you had a patient that had allergies to salicylates. What drug would you not give? And of course that would fall into you would have to choose aspirin in this. All right, its class. This is a platelet aggregation inhibitor, also known as an antiplatelet. This also falls into the NSAID or non-steroidal anti-inflammatory drugs. Their purpose is to decrease the inflammatory response. This is also a antipyretic, which is a fever reducer and a mild analgesic. But the main thing we're going to be giving it for is for an antiplatelet. So your indications for aspirin, your only indication to give aspirin would be for chest pain due to acute coronary syndrome. What we would not use it for would be something like a chest wall pain. We would have to think this is a cardiac event, which would fall into the acute coronary syndrome. Contraindications, as with any medication, any hypersensitivity to NSAIDs, which is a very common allergy, salicylates, like we said before. If we've got any type of active ulcers, any type of active GI bleeds, or any type of internal bleeding, hemorrhagic bleed, we would not want to give aspirin. So some of the precautions for this, we would not administer this to children due to the increased risk of Rye syndrome. Rye syndrome would cause brain and liver damage. So I would, in general, I would not give this to anyone under about 21 years of age, unless they had a known cardiac history. As far as asthma goes, this would be a precaution. There has been some correlation between asthmatic patients being administered aspirin and having a detrimental outcome. That would fall into your local protocols for the use of a chest pain patient with a history of asthma. This comes supplied in a chewable. This is a non-enteric coating. Enteric coatings are the little kind of candy shell that's wrapped around most of your over-the-counter medications. And the whole purpose of the enteric coating is for it to pass the stomach without the stomach acid breaking it down, so it can get into the small intestine for digestion. These here are non-enteric coating. They're chewable. These come in 81 milligrams each. This is a very common drug that your patient with any type of cardiac history will probably be prescribed. Normally they're going to be taking a 81 milligram chewable tablet per day. Our dosage is going to be anywhere from 160 milligrams to 325 milligrams. If you look at the 81 milligrams, we want to take pretty much the standard here is 4 of these. 4 times 81 is 324 milligrams. Now, most literature will say up to 325 is fine, and that's because there are some manufacturers that will produce a 1 tablet aspirin that is 325 milligrams. If that's what you were supplied through your employer, that would be completely appropriate. There are some systems out there that recommend a lower dose down to 160 milligrams. But pretty much the standard is going to be 4 81 milligram tablets for acute coronary syndrome. Of course, the route here is chewable, so this falls into the oral route of administration. That pretty much wraps up aspirin. As always, if you got any questions, feel free to hit me up.